So after finishing from the first, from the flexors, now we go to the extensors. With the extensor part of the hand, all the muscles of the hand, their muscle belly and the origin of the muscle comes from the forearm, and they get inserted into the hand. The skin of the dorsal aspect of the hand is more pliable, is more thinner, and it does not have dermal attachment, so it accumulates edemas. You have 6 compartments involving the hand. The 6 extensor compartment. Over them, they are held by the extensor retinaculum, and in each tendon, in each compartment, there are tendons. They run in a separate tendon sheath. So you have the extensor pollicis brevis, you have the abductor pollicis longus, and they are responsible for the extension of the thumb at the level of the MP joint. The abduction, that is for the abductor pollicis longus, and you have the second compartment, which they are responsible for the wrist extension, okay, and radial deviation of the wrist after the extension. This is the extensor carpi radialis longus, extensor carpi radialis brevis. Extension of the fingers to the level of the IP joints, that comes from the EDCs. And we have here as well some of the junctura tendinum, so they can mask somehow the finger cut if it was proximal to that, if it was distal to the junctura tendinum. And you have a third compartment, which is the extensor pollicis longus, and they get all the way inserted into the IP through the Leicester tubercle, which is located here, okay, and they are responsible for the extension of the thumb at the level of the interphalangeal joint. Then you go into the extensor digitorum, the extensor digiti minimi, which are responsible for the extension of the little finger, extensor digitorum digiti minimi, and the extensor carpi ulnaris, which are responsible of the ulnar deviation of the wrist, which can be somehow, in some cases, subluxed. In certain traumas, it can be subluxed with the patients with a severe, with the wrist instability or rheumatoid arthritis. So that was an overview of the extensors of the hand.